Good afternoon. Another roll call. Mr. Michael Cook. So we can proceed as they are already seated with Madame Tillman. Mr. President.
Okay, thank you. I'd like to move now to an oral presentation by the International Institute of Concerned Public Health, as outlined CMD 13M 51.59 and 51.59A. And I understand Ms. Tillman, you'll make the presentation. Please proceed.
There you go. I should know better by now. Good afternoon, members of the Commission, and we appreciate the opportunity to make this presentation. With me is Dr. Gordon Albright, also of the Institute, and he will be assisting and answering questions that you may pose. So with that in mind, the reason that I am here personally as well is a concern for the nature of the operations at this plant and the impact of these operations on the health and well-being of the local community and on workers. Sorry, I have to go back one. You've heard the descriptions of the facility at various times, so I'll go through this very quickly. It's been 60 years almost in operation. It was converted from a former GE facility. I'm not sure what retrofits were done in all this time to make it suitable for making these pellets. I think it would be good to know what this is doing. You'll notice that while the pellets are shipped to the GE-Hitachi plant for fuel bundles for the CANDOs, some, and we don't know how many, are also shipped to a GE facility in South Carolina, and we hope to get some clarification of the nature of how they may be used. We are here because of community concerns that have made this a very public issue. The concerns have ranged from lack of transparency about the plant, and we've heard a lot about that from other interveners. Also, the nature of the vicinity of the plant has been transformed. It has transited to a highly residential area, quite different from what it was, certainly in 1905 and in 1955. So there are concerns about this plant, the potential for adverse health effects, transportation issues, emergency evacuation plans, where are they? And a big question the communities have, and we have as well, what have government agencies done? Have they done enough to protect the health of the community? And while I'm on this, several questions. What studies have been carried out long-term on workers in the plant? Not just during their time, but long after they've left the plant. What levels of exposure of uranium and other hazardous substances have been exposed in the legacy of the operation of this plant, not just the last few years? What about residents, children? People move in and out of the plant. It'd be very hard to track if they had any long-term effects. What role has Toronto Public Health, provincial health, public health departments, and Ministry of Health, MOE, Health Canada, CNSC, other agencies have had with respect to this facility? It hasn't been very clear to the residents. It's not clear to me, certainly. Were the residents made aware of this facility before moving into this area? Has the facility filed an evacuation emergency plan when it first operated? And has these plans been updated with community involvement? Some concerns have risen about there. Also, at the time that this plant was built, what were the standards? Because it was only in 1997, approximately, when the Nuclear Safety Act came in, that prior to that time, the public dose was 5 millisieverts and then went to 1 millisieverts. No idea what happened in the early years. So these are some of the concerns. You've heard some discussion about uranium health effects and the various routes of exposure. Dr. Edwards and others have presented on this, so I'll just go over this very quickly, but it's very important. Uranium is an alpha emitter, and yes, while external radiation is not the critical thing, it is internal, nevertheless, It just takes one, and an alpha particle in any part of the body to create possibly a problem that won't emerge till many years later. And while it's kidney toxicity has been the predominant effect that has resulted in air standards by MOE, if you add on to that the cancer effects, the radiological effects, not just cancer, but other hematological disorders, you have a problem here. And also, there's a cumulative effect over a long time. There's vulnerable populations, which are most sensitive, and workers who are directly exposed to this radiation. I'd like to turn to the CNSC staff report, which I have reviewed a good element of, and in particular, because of the meeting today being with GE-Hitachi, looking at what was provided in the report and the license limits. And we've heard mention of these limits being overly generous, to say the least, and the license limits, it's come up already, discharged to sewers. Now, 9 tons a year being allowed is one thing. We understand the facility doesn't emit in that order, but 2.7 or 2 kilograms per year, we're talking about a very dangerous substance. And it's beyond belief that CNSC will still keep those license limits. In fact, you were reviewing license limits, derived license limits last year. I remember we responded to a paper on a review of these limits. And we really urge you to look at these limits the way we as a public look at them too, and say, these are really permissible. What if there were an accident? What if GE-Hitachi did release anywhere near that amount? It would be permissible. But is it human? Is it acceptable? What happens if they would emit 8,500 kilograms? What would happen then? And this is allowing something that may happen. Accidents happen. We don't know. But this is an allowable limit. It's not a limit that encourages reductions of emissions by any means. So feeding on to that, this slide just talks about the relevance to actual emissions. And the public is really not informed. There's calculations done to determine these limits, derived release limits. They're also built on models, but they don't provide a meaningful basis for determining the so-called safety of the plant. And there's no confidence that the oversight by CNSC is indeed adequate to assure public safety. I want to turn to something that I found very astonishing in the report, in the staff report. Okay, I want to turn to this, what was called the equivalent dose exposure for extremities and skin. I've been on the CNSC website to find further information about this metric, but I think I figured it out. But then I see that for uranium processing facilities, extremity and skin dose is set at 500 millisieverts per year. Now, that is a number which should shock people that are used to seeing public doses of 1 millisievert per year, or for workers, 20 millisieverts per year, cumulatively no more than 100 millisieverts in 5 years. The difference is in the use that I've tried to underline here of equivalent versus effective. This is something that it would be very obscure to the public, and this does need some clarification. Now, when we talk about GE-Hitachi Toronto,
can you please stop videoing? You're disrupting this hearing. Can you please stop it?
Yeah, I just want to, this is an important slide, and it's important for me to get through.
Can you get off?
Yeah, if you don't mind, yeah, so I can talk about this, this issue. It's very important. This is something of which there's been no transparency. Sorry, I'm going to have to repeat a little bit of this, okay? When I saw this, I did go to CNSC's website to check if this were available. The definitions were available there. I couldn't find a definition, but I have done a belt calculation from effective to equivalent doses to figure out where the 500 came from. And I think I might be right, but I'm asking the question, how was this metric determined? What is the justification of its use? Where else it's being used in the world? I can't find it when I check documents, international documents, only in this report. I was also made aware Blind River, of course, being a uranium processing facility, also has this kind of metric. Now, talking about GE-Hitachi, I'll go to the second point there. The maximum, what's called extremity dose, was 357.29 millisieverts in the year of 2012. So this was received by one worker. It's the highest level overall nuclear facility processing plants ever. There's an action level of 350. Now, on what basis can CNSC find this level of exposure safe? What is extremity? What extremity was exposed? I mean, I'm thinking extremities, nose, hands, feet. I mean, what kind of protection did this worker have or not have that led to that dose? How does one know that there wasn't any alpha absorbed by this individual? That the only, how can one assume that the only thing that was affected was some extremity? And as I said, I don't know that. I'm assuming it's hands, but I could be wrong. But what kind of protection do people have? I find this particular thing astonishing and not clear. So it's obscurity on the part. I've tried to figure it out. Now, going to the actual report itself, because it was scoped for the 4 years, when you talk about a plant that's been in operation for decades, you don't get a sense of what really went on in the plant. And I know there's been other yearly reports, but a plant like this, with its length of time, needs some history, it needs some context to know what was going on, because there's a legacy issue here. Okay, and there's no tracking of that history, of that legacy, and hence there's no ability to analyze the cumulative effects that have happened over the time on the environment. There's no indication of what kind of retrofitting or modifications or changes have been made to this facility to improve its performance. No information on the quantity of pellets that are made or shipped to the plant in North Carolina. Now, I noticed in the staff report when I was looking at the mining information, the mining, I could find the quantities that were actually mined. I can't find the number of pellets that are mined. I think if you're going to do a report, it should be looking at the same parameters throughout the report for all your facilities.
Can you please hurry up? We have got you documents and we got your presentation, so could you please
Yes, I'm trying to do the best I can. There's a lot of pressure, okay? And if you don't mind, I'd like to continue.
You've been with us long enough to know the rule of procedures here, so please respect it, okay? So please go through them a bit faster. We've read them and we would like to ask some questions.
Definitely. Okay. All right. I will do my best. The soil, I like to go into the soil report, and these are guideline numbers that are produced by the Canadian Council of Ministers of the Environment. I'd like to stress these are guidelines. They are not legislated limits. And Ministry of Environment has just adopted these guidelines. There are limitations to these guidelines, and you can read this from the slide. There's lack of Canadian-specific data. These values, when you see values like this, there's no confidence limits to them. They just give a number. They don't say plus or minus so much to allow for any variation. Exposure pathways, not all exposure pathways were evaluated, and so on. And the 300 milligram per kilogram guideline for industrial sites is not appropriate, especially considering the density of the population in the area. I won't belabor these. These are the numbers that were produced. I will go to a critique of these numbers, since that would get me through this faster. These sampling results, this was a one-time sampling result that was done, I believe, in June of this year. Several factors can influence a sampling, especially a one-time sampling, from weather, irregularity of soil, depth, and so on. There's been no consistent frequency of sampling and testing that's been reported, a one-time shot. The guidelines, the CCME guidelines themselves have not been updated, and they're very limited as noted. And we've heard before that there's two different methods that were used, different locations, and you cannot reliably conclude that there's no adverse health effects. CNSC findings overall have rated the facility as satisfactory and fully satisfactory. The soil samples report's key finding is uranium levels pose no risk. We don't find this justifiable and unsubstantiated. So in conclusion, the lack of transparency of this facility operations is unacceptable. Public right to know supersedes industrial interests. Maintaining this facility in a residential area is unacceptable, and the key findings are not credible, and the residents, their concerns will not be alleviated by such findings. Therefore, it is really regrettable that the license for this facility was extended to 2020. Given all the issues and concerns regarding this facility and the length of time it is operating, we recommend that this facility close its operations well before it's expired, this date well before, and then detailed commissioning plans be developed with community involvement. Thank you. Oh.
Thank you.
That's.
Thank you.
I'll save it for later.
Questions? Ms. Hervé?
GE, can you comment about the maximum extremity dose of 357.1 millisievert per year? Could you comment that?
For the record.
Is it correct to say that's the highest level in the industry?
For the record, Paul Desiri. So I need to explain the difference between equivalent and effective doses, because I think that was one of your questions. Because it's important to understand that the numbers, you can't compare equivalent and effective doses. So one is threshold-based, equivalent doses are threshold-based, and effective doses are risk-based. So what that means is, with risk-based doses, your risk is proportional to the dose received. With equivalent or deterministic, if you're below the threshold, there's no effect. Now, the actual dose limit has a safety factor built in, and this is below the dose limit, so it's a safe exposure.
Staff, can you comment?
Melanie Rickard for the record. So I'm going to start by trying to describe both the effective dose and the equivalent dose. Understandably, there is some confusion surrounding this because we have two quantities that are in our radiation protection regulations, and both quantities have the same unit. So understandably, there is some confusion. Dose limits are prescribed in the radiation protection regulations for effective dose and equivalent dose to the skin, the hands and feet, and the lens of the eye. First, the effective dose takes into account the fact that different organs and tissues vary in how they respond biologically to radiation. And this difference is expressed in terms of tissue weighting factors that are also listed in the radiation protection regulations. The weighting factors consider the susceptibility of an organ or tissue to cancer incidence and cancer death, for example. So the effective dose provides a single quantity upon which to base the protective limits to reduce the likelihood of the effects. So that's the quantity of the effective dose. That is the 1 millisievert public dose limit, and for example, the 50 millisievert per year, 100 over 5 years for workers. Now, because certain tissues on the surface of the body, such as the lens of the eye and the skin, show different types of effects. For example, the skin burns at high doses, for example, and for the lens of the eye, cataracts. Because of these effects, and the gentleman from GE correctly described that these effects are said to be expressed above a certain threshold. We set limits which are called equivalent dose limits for the lens of the eye, the skin, and the skin of the hands and feet based on those thresholds. And the dose limits do build in a safety factor. So, for example, the dose limits for the hands and feet to protect the skin of the hands and feet are 500 millisieverts per year for a worker, where we know that the threshold for skin burns is at the lowest at around 7 sieverts. So that's 7,000 millisieverts.
Where is that? I think the intervener wanted to know where to find it. Where is it all found?
Absolutely, I was getting to that. It's found in the radiation protection regulations. It's described in a document called the Introduction to Dosimetry, which is info 0827. That's posted on our website. And I'd also like to add to the record that these limits are also used by the ICRP, ICRP 60, most recently ICRP 103, and in the IAEA BSS. So these limits are used by countries all over the world.
Thank you.
Yes, just another question to G. It's about the quantity of pellets going to USA, North Carolina, and what is the use of those pellets there?
For the record, Peter Mason. I'll start by saying our license is for 1,800 tons a year. Typically, we produce approximately 800 tons a year of pellets. Of that, 50 tons approximately, because it can vary slightly from year to year, approximately 50 tons is shipped to our parent company in Wilmington, North Carolina. And the reason they require the pellets is that for BWR, that's a light water reactor, fuel rods, the fuel rods are approximately 12 feet long. And to balance out or to get the appropriate isotopic profile along that 12-foot tube, they insert natural uranium pellets in order to achieve that profile. And I know that there's been some question about what do we mean by natural uranium. For us in the industry, that means it's material that has 0.7% of the isotope U-235. And so that's what we refer to as natural uranium.
Thank you. So it goes into power, again, electricity production in the state.
That's correct. It's used in the production of fuel rods for BWR reactor fuel, which is used in the United States.
Thank you. Ms. Hervé? Anybody else? Yeah. Dr. McDill?
Going back to the extremity dose of 357, that was over an action level of 350, if I heard correctly. Exceeding an action level, that would have been reported to CNSC. So there is a report somewhere on the website for 2012, or is it personal information, this particular thing? Usually we get an early notification report.
For the record, Caroline Purvis, Director of Radiation Protection Division. Yes, this was reported to the Commission, but no, we don't do early what do they call EIR for this particular type of incident. Yeah.
But it was reported to the Commission.
Absolutely.
And since the intervener asked, and I believe someone yesterday asked also, the individual is fine.
Yes.
Going back, and since the action level was exceeded, what was the action taken by GE-Hitachi what corrective actions were taken?
For the record, Paul Desiri. So I should explain a bit about the way in which this dose is determined. So it is to the hands. That's how the hand exposure is measured, and that's how it's compared to the extremity dose limit. The actual process that this operator uses, they use their hands to manipulate the pellets. In this particular situation, there was we were undergoing a quality situation, so there was a lot more inspection required than normal. So it just so happens the rings are an interference with that task. So we do a sample of 1 week per quarter, and then we extrapolate that number. We take a conservative estimate so that we make sure we don't underestimate. But in that case, the sample period was during the time when the quality excursion was happening, and there was a lot of manipulation by hand. So there's a couple issues here. One is getting more representative weeks in situations where you have a higher fluctuation than normal. There's been an action leveled around that. The second is the implementation of a control level to give earlier indication of this potential for higher numbers. That's been implemented. And the second is looking at the actual task that the operator does for this particular inspection during a quality excursion, and that's been dealt with. And the fourth is connecting the hazard analysis with change control, and that's also been completed.
Okay. Anybody else? Yes. Dr. McEwen? Dr. McEwen?
So we've heard a lot, and there was a helpful slide and helpful abstraction in your submission around the soil levels. And we've heard a couple of times that the monitoring in the boulevards in the community have demonstrated levels that are equivalent or close to equivalent to background. Perhaps somebody from staff could explain what that means and how reproducible that would likely be if you went to multiple different sites across the city.
Mike Rinker for the record. When we're making comparisons to background, the Ontario Ministry of Environment published and since revised a document describing what are Ontario typical range values. And there are values that are published for urban settings and for rural settings. So I think our understanding of what background is in Ontario is fairly solid. The values that we've observed around GE and that MOE has observed around GE in the residential area are within that range, with the exception of two that are close to the facility. The CNSC analyzed those two values that were slightly above background in the 2.53 and 2.9. So the pattern is what we would expect, and I would expect as you move away from the facility, they would remain within background. So I think they would be, the methods were used were appropriate, the analysis was appropriate.
So could you explain in lay terms what background is?
Right, Mike Rinker for the record. So uranium exists in all solid geologic materials, varying levels. Crystalline rock like granite rock has high values of uranium. Sedimentary rock such as carbonate rock that's in the Toronto area has uranium in it. So it does occur naturally. It occurs throughout Ontario, independent of the nuclear industry. And so when you observe background values, what you're observing is the values of uranium that exist if there was not a uranium industry.
So does that help some of the interveners in understanding the relationship of the measured values to values you would get on the other side of Toronto?
I don't think it helps really at all. I'm very well background of the implications of background, that we have naturally occurring uranium. I'm well aware of that. However, these measurements are taken after the plant has been in operation. So it's very hard. We don't have a base by which we can compare it with, okay, before the operations. Secondly, as I've tried to allude, how these measurements are taken are not consistent. Also, we have the other factor that the uranium will have traveled. So even though you may sample around there, around the plant further on, there's no sense of how much might be deposited further on or over time what has happened. So to say something is below background makes absolutely no mathematical sense. You know, your background is whatever the base is, but we don't know the true background of that area before the ground was disturbed, before anything happened.
So let me understand. If you have measurements across the whole of Ontario, which the MOE have, and they are consistently the same across the whole of the province with small amount of variation? I'm sorry? Why would you expect the base values around the plant to have been different 100 years ago than 2 miles away?
There is a range in background levels because of the rock structures of our province, of the country. It can range quite a bit. Background levels can range a fair amount. Now, when you're talking a fair amount, they can range from maybe 2, 2.5, 3. That could be enough to affect these levels that are measured here. I'm not sure. Some of them could be natural background, some of them could not. I think it's very hard to filter out the differences because you don't have the variation is such that you don't have the ability to filter out the difference between the plant being there or any depositions left from air depositions and not. It's too hard. It's too variable. I think MOE would agree that there's quite a variation within a range of background levels.
I think there's another very important point that needs to be made here, and that is that background radiation, like all radiation, causes disease and death. And any additional radiation that you add to background radiation causes additional disease and death. So the fact that radiation is comparable to background does not mean that it's harmless. On the contrary, all additional radiation causes harm.
So let me understand now. Across Canada, the average is, I don't know, 1.8, 2.5 millisievert, and we all slowly dying? Is that your assumption? Is that what you just said?
No, I did not say we are all slowly dying. I said that whenever we add radiation to the environment, people die who would not otherwise have died.
No, but the current variation here
by
now...
by your safe standard, supposedly, which is 1 millisievert per year, that is based on 1 additional cancer per 20,000 people. Now, if you take that, and of course, the other thing is, this radiation stays from uranium and transuranics for the lifetime of the Earth. So when you consider the total casualties that are going to be caused over the lifetime of the Earth by all this, it represents a very large number of people. Over 20,000 years, 1 excess cancer per 20,000 people represents the average population of the Earth over that period of time. This is a number of additional deaths that dwarfs all the human slaughter that has ever taken place in the world, including all the wars that have ever been fought. So this is a very serious issue. Just because these people have not yet been born and have no voice does not mean that they don't matter.
Thank you. No. Thank you. Thank you for your intervention. You have the final word.
I think the final word would be the conclusion there. I think no matter how you cut it, the information that's given, the one-time kind of testing due to pressure from residents, does not give comfort to people that this is a safe operation. It is not a safe operation. Please reconsider the license requirement there. The other thing I have to say is I'm astonished at what I've heard about the extremity dose. I'm very well aware of the difference between effective and equivalent doses. I've done my homework on this. I don't like to be talked down to on this. Those tissue factors are only approximate. We still don't know, why did this worker only work with hands with no protection? What is going on? And finally, just a little comment. Ms. McDill, you are asking about something that you think the public would like to know, the difference between becquerels and grams. Well, we have the answer for you. That it wasn't.
What the difference between becquerels and grams is, I was asking for basically for the sewage system, we have one that's quoted in grams, we have another intervention
right,
that's called
okay,
becquerel.
okay.
So it's a different thing.
Okay.
And I think when we ask something about the difference between, say, effective and equivalent, we're not necessarily assuming that you don't know the difference, but there's a broader community here who may or may not know the difference.
I appreciate that, because it's a very complicated issue. But I think that I am leaving here with a lack of comfort over that kind of level. How is that worker going to be tracked? One can say they're okay right now. You don't know what's going to happen. How can you be definitive that no other part of the body or anything else was absorbed, because you're only using the tissue factor of 0.01 for skin or eye? So, I mean, this is you asked me for my, I'm left feeling uncomfortable about this.
Mr. Chair, can I just pursue that one a little bit longer, since I was the one who raised it?
Okay, very
I
quickly,
got that.
please.
Yeah. Two questions. One additional cancer in how many? And then, he said 20,000 is what was it? And then, how any worker who exceeds an action level, how is that worker tended to in the years that follow?
Patsy Thompson for the record. I'll try to respond to the one cancer in 20,000, and then Ms. Rickard will talk about tracking of workers following an exceedance of an action level. So in terms of cancer risk, the values that are given are provided for the use of the linear no threshold model and the public dose limit, or the worker dose limit, depending on the on what is being done. We have done a study of more than 40,000 Canadian nuclear workers who have been exposed to several sieverts of dose over a very long period. And that study shows that there is no relationship between cancer incidence, cancer death, and radiation exposure. There is no relationship between cancer mortality and tritium exposure. In terms of the information that was provided by the intervener in terms of natural radiation causing thousands of people to die, across Canada, the natural background radiation varies between 1.8 to about 4.7. And in Colorado, for example, it's in the high teens, so in the 15 to 18 millisieverts per year. There is no difference in cancer incidence or cancer mortality between an area like Colorado that has 18 millisieverts per year of background radiation and areas that have 1 or 2 millisieverts of background radiation. So this is simply not an appropriate statement, and it is an inappropriate use of the linear no threshold relationship.
Melanie Rickard for the record. Each licensee is required to ascertain doses for the workers, and in the case of GE, they used dosimetry for the whole body external exposures, the extremity exposures, and the internal exposures, including radionuclides that emit alpha radiation. All of those doses are tracked by the licensee, and they are required to maintain those records for quite a long period of time. If an individual ever wants to go back to the licensee and retrieve their records after the fact, they can. And in this particular case, we know the dose records are also in the National Dose Registry, which is available for anyone at any time to retrieve their dose history in this particular case. But as we've mentioned, not all doses go to the National Dose Registry, regardless the licensed dosimetry service, if used, or the licensee has to keep those dose records.
Okay, thank you. We got to move on. Thank you very much.
I'm sorry, I can't leave Patsy Thompson's comments unanswered. It is well known that a single alpha emission within a human being can cause a cancer. It is it's beyond credibility to claim that exposure to radiation causes no additional cancer, as Patsy Thompson is. There's absolutely no scientific basis for this. There's no basis in experience, no basis in logic. It is, and it reflects on CNSC's scientific credibility that they allow statements like this to continue to be made in their name.
Thank you.